Hi, everybody. Excuse me, it's Patricia Coughlin, and I wanted to let you know I'm going away. I'm going to be out of the country for several weeks. I won't be back till June 1st. So I'm going to take a little break here. But before I did, I just want to emphasize once again that ISTDP is based on psychoanalytic theory, and it is a psychoanalytic method. And Davin certainly thought so. And so, what that means is that we understand symptoms and suffering as the result of unconscious conflicts regarding the patient's feelings and impulses, wishes, and fantasies. So, it is imperative that we discover and identify what the patient's conflicts are, and then we work to actually intensify those conflicts, the conflict between the wish and desire and feeling that's wanting to come up and be expressed, and the anxiety and inhibition that's coming in to suppress it. And so when you're intervening, it's extremely important that you speak to both sides of this conflict. I see too many practitioners either just pressing to feeling, ignoring the defenses that are coming in, not attending to the anxiety, just going for feelings. And others who are excessively focusing on defense and resistance, and they're not really focused on a particular incident or someone on the triangle of person. And so to be effective, first of all, you have to be somewhere specific on the triangle of person. You're looking at symptom generating situations, right? So the patient has panic attacks. You want to look at, well, when was the last time you had one? What was happening there? So you're going to find out, oh, I had a conflict with my boss. Okay, so let's look. So you're in a specific situation with a specific person, and then you're going to begin your first move, right? In our sequence of interventions is you ask, I wonder what kinds of feelings you had toward your boss, right? How do you feel toward him even now as you tell me about this? And then you're going to watch. Can the person say what they feel? Do they become excessively anxious, or do they go to a defense? In most cases, people go to defense. They start to rationalize, justify, whatever it might be. And so, again, you want to work with the person, right, to look at all three parts of this, right? So you're telling me what you think about them. That's not your feeling. In fact, that's a way to avoid your feeling. What kind of feeling do you have toward him, right? And once, let's say the person can say, I was really angry, I'm pissed off. And of course, we're going to ask, well, how do you experience that feeling inside? And again, very often, because people have conflicts, you're going to see all three. They're going to make a step along the way. Now they can say they're angry, but get anxious about feeling it. Or they'll defend against those feelings, or certainly the impulses. I'm angry, I'm revved up, I'm really mad at him. Well, what do those fists want to do? Oh no, I'm not a violent person. Okay, but that's what comes up. So you have a choice here. And this is where you're going to work to really intensify the conflict, right? You clearly have anger, right, that you're anxious about and avoiding in ways that hurt you, right? You see that now. Right, so you have a choice. You want to have an honest look at these feelings, or you want to continue to rationalize, justify, cry, go helpless. I mean, isn't this how you get yourself depressed? Right? So again, you're working around the triangle of conflict, right? So conflict is the point, right? Identifying and intensifying the conflict, not just hanging out at one aspect of the conflict, just the feelings or just the anxiety or just the defense, right? So I hope this is an important reminder to keep your eye on the conflict. What are the underlying conflicts responsible for the patient's symptoms and suffering? Once you identify them, You need to be somewhere specific on the triangle of person, and you're going to work to intensify that conflict until the person turns on their defense and the feeling comes through. So I hope, again, this is helpful to you, and we'll talk again in June. Bye-bye.